Well, lower back pain is one of the most common reasons for outpatient visits to doctors. But experts say there is a lack of consistency in how to best deal with these cases. Now, there are new guidelines for treating lower back pain that doctors are hoping will improve patient care. Joining us now is Dr. Mehmet Ozman. He's a chiropractor and friend of Ebru today. And thanks for joining us. And Dr. Ozman, you always bring so many different things onto the sets. Right now, you and I are sitting with a tree between us. Can you explain this?
On the table.
And a patient on the table.
What is going on? Is he a victim of Hurricane Sandy?
I don't.
And no, this is not Christmas, but what we're talking about today is the mama of all chiropractic that everybody knows about chiropractic, and that is low back pain.
Yep.
It's not the only thing about chiropractic. Remember, we talked about that the nerves control everything, and the chiropractors clear nerve interferences by unblocking the subluxations so that the body can start to heal itself. Now, Marlene, our director, asked, try to make it topical. So I'm bringing up Hurricane Sandy.
Well, I'm actually going to say something about that. I was talking to a friend of mine who happens to be a nurse in the emergency room, and she says there's more cases of back pain injuries right now because of Sandy, because all the folks are moving things and lifting things. And
they're not used to it. And a lot of times, people don't know that they have even a problem. Like our friend here told me he has no back pain problems. Well, I said, well, let's look at this. For example, all the electricity went out in so many homes during Sandy, and this is the demonstration. The brain sends electricity down to the body to make things work. So, like with Hurricane Sandy, when a tree with heavy snow or blowing knocked the power lines down, from there down, the electricity could not get through and the houses had no power. So similar to here, if something's blocking from here to his low back, he's going to have if there's a blockage, he's not going to have power to his low back. Now, he did not know, you can put that down,
okay.
Lift this leg up, and I'm testing the muscles because, again, muscles are controlled by nerves, as is everything. So if I tell him to hold this real hard, come on, buddy, hold it real hard. He can't hold it. Try this one, hold real hard, and that muscle is getting some power, but not much. So it could be something in his low back, but it could be something in the mid-back, neck, or further up. I examined him earlier. If he touches at the base of the skull, where I think the blockage is, if I tell him to hold this leg up, lift, hold, and you can see that he can hold the leg if he touches that point, because we're short-circuiting the short circuit. Now, let go of this a second. Turn this way, buddy. On your side. On your side. There you go. Now, we could adjust this low back. Good. Go the other way.
Glad I'm not in this segment now.
Maybe you would want to. Stay there. Now, as I demonstrated before, that there are many ways to adjust things. So I could have done this by gun. So we concentrated on his low back. Now, on your back.
Now, is low back pain, that's absolutely the most common as compared to the shoulders, or?
Most common because walking upright is a tough situation. We've got maybe a 5 or 6 foot person on these legs. It's easy for it to go out. Now, I've adjusted his low back. Lift this up, hold, and you can see that still power is not getting through. So if I only looked at his low back, he's going to have to come back to me. But if I look at his neck and the base of the skull, and I'm adjusting with the gun.
And what exactly does that do?
It shoots just like my hand does, but in little taps. So it's a much gentler form.
So it doesn't hurt at all?
It could, it may not. Or I could have adjusted this by hand.
Okay.
Now, if I unblocked his neck, let's see if the power gets through. Hold real hard. Hold real hard.
And for our viewers, I can see how much pressure you're putting on him.
So the point here is that the brain was blocked to the low back, not only at the low back, but also at the neck and the base of the skull. So we have to look the whole track, just like the tree knocking down the wires. Anything further down was not getting power. Now he's getting power. And again, I'll remind you that this guy said, I don't have any low back pain. But if he didn't have this power going through, pretty soon he might feel it. So just like you said about the workers, plenty of people out there not knowing that they're blocked, just like not knowing you have a cavity so you need to go to the dentist, they're going out there doing stressful things and straining their low backs.
Now, you showed us some sort of treatment, but what about long-term treatment?
Long-term treatment depends on the severity. There's 4 grades of herniation. Everybody says, I have a herniated disc, and I ask them, what grade? There's 1, 2, 3, 4. 4th might require surgery. But 1 and 2 is easy for chiropractic.
Okay.
To get the joints unlocked enough to get the nerves through so the body can withstand the forces and the strains that the body's being put under.
So if I could actually have lower back pain or something wrong with my lower back, if I have like maybe a pain in my leg or something?
Could.
Okay.
Or you may feel nothing at all. That's why my biggest pet peeve is people say, I feel fine, doc. Well, feeling fine doesn't get you anywhere. You could have high blood pressure, you could have diabetes, you could have a cavity and still feel fine. So it's good to go to a chiropractor to get checkups so that to see that the spine is clear of any interferences to the nerve, then the body can heal itself and fix itself.
Well, it's always great to see you, and I always love your demonstrations.
We got to make it exciting.
Well, thank you so much for joining us again. It's always great to see you.